Our focus now on matters health. The Ministry of Health has announced 1,030 new COVID-19 cases from a sample size of 8,316. This now means the positivity rate is at 12.4%. Meanwhile, 422 patients have recovered from the disease in the last 24 hours, 105 from different health facilities and 317 from home-based and isolation care. Sadly, 21 deaths have also been recorded. Now, the Kenya Union of Clinical Officers, KUCO, has called on the Ministry of Health to stop being biased with the daily COVID numbers. The Secretary General of the Union, Gibore, says that the daily COVID update for the longest time has been biased and never has it been genuine. Robert Ouma with more.
The union says the government at one point has never been genuine with its daily COVID-19 numbers briefing.
We cannot be saying that this is what is happening. Because you are testing in Nairobi, a majority of people being tested are coming from this region, then you say this is the affected area. I've traversed this country, I was in Migori last week, and none of the people are taking measures. None of these people are taking measures. Is the government blind? They know what is happening. So we must stop politics, and this is the painful thing that we are undergoing as healthcare workers. And we feel that the government, as much as we have come up with good policies that need to be implemented, the government have gone to sleep, and they are actually either playing politics or they are actually focusing on other things, like the latest thing that has happened in this country, going for more loans when every Kenyan is suffering.
And what are Kenyans' take on this?
Ugonjwa iko ndio kweli iko, lakini kwa serikali wana exaggerate too much. Wame exaggerate sana sisi watu wa Nairobi tumeumia.
According to the union, the government is liable for the surging COVID numbers.
We as the healthcare workers, we are struggling to bring the numbers down. We have other people in the names of the politician and the leadership in this country actually pushing the numbers high. I think it is a shame on them, and I do not feel that they have done good. And remember, they are the ones who have been tasked to manage our resources. When we get resources being lost and we find up to date, we have areas where healthcare workers are being forced to use a surgical mask, one surgical mask for the whole day.
The union now says the country is likely to experience a reoccurrence of other eradicated diseases since the government is only prioritizing treatment of COVID.
We have been doing very well in terms of a number of other of actually bringing down the number of HIV infections, TB, and other conditions. But what has happened is that we have not gone to sleep. Remember, when COVID came, has totally affected, including the normal immunization mini schedules for the young children. So what happens? We might be seeing polio cases coming back to this country, where we have been going to zero. So, and this is a serious thing, that the effect for this COVID-19 might not be seen right now, but we might be able to see this in the next 3 to 5 years. We will be surprised.
They're now calling on the government to go back to the drawing board and build a healthy nation, and this cannot be achieved through politics.
It is painful, and that is why we feel that the government has totally failed, but the healthcare workers have remained resilient to ensure that the country is protected and they will bring down the numbers of the COVID infection.
Robert Ouma, Switch TV News.